Hello, good evening, everybody. This is FMG Hack Series, and today we are going to talk about the microbiology. So, speaking about the microbiology, we are having a variety of high yield areas. So, in this microbiology, the area we are going to talk about is your bacteriology, which is a very high yield and contributes for about 40% questions in microbiology. And then you have this immunology, and followed by the immunology, which is the second most high yield area where you may have the minor topics like a virology and mycology and parasitology. So speaking about this microbiology is one of the hidden giants, people, because like we may expect to see the questions from PSM, communicable diseases. You may also see certain bacterial and fungal infections. So, and in the case of your endocarditis, which is technically a medicine question, but you may expect to see the bacterium or the organism which is causing the infective endocarditis. So we have the variety of infection in all over the body. So we have the variety of bugs. So this microbiology is kind of like a hidden giant that you have to remember inch by inch and detail by detail. So speaking about the analysis of the past paper questions, we got to see that there are most of the questions which has been coming from the bacteriology. So today we are going to deal with what are the high yield areas and what are the bugs you need to study in common in each and every aspect of your microbiology. We discuss that in detail, and then we wrap up the session for microbiology. Speaking about the microbiology, we are talking about the general microbiology at first. So in the general microbiology, we used to talk about the organisms. The taxonomy of each and every organisms are pretty important and high yield. And speaking about the morphology of your bacteria, virus, fungi, and parasites, and classification of each of them is pretty important and high yield in terms of your general microbiology. So that in turn is really important. So you need to read about the apart from that, you need to read about the bacterial staining, how we are staining, and what are the gram positive and what is gram negative, what will be the cellular cell wall differentiation in gram positive and gram negative. All those things will be discussed here. And apart from that, you may have the host microbe interaction, innate and adaptive immunity, host defensive mechanism against the infection, and host pathogen interactions, everything. And then the lab diagnosis of the microbial infections, such as like a culture, collection, transport, all those primitive areas you have to remember. So for example, like we have a different varieties of culture media. For example, selective media, enrichment media. What are the features of each of them, and what are the organisms that follows each of them are pretty high yield one you have to remember. And then the very weightage area is so called as bacteriology. Speaking about the bacteriology, you have to remember gram positive, gram negative. In the gram positive, the important ones to be remembered are your staph, strep, and bacillus and clostridium tetani are the four important gram positive bacteria you have to remember. Most of the books and materials have the unique way of like charts where we expect to see the all the gram positive, gram negative cocci and their transport media. VDMA has a QRS book which contains a table of series like what are the name of the bacteria and what the culture medium that it goes, any other specifications, morphology, and other notes. What are the diseases does it cause? Everything was organized, well organized as a table in the QRS, which is very helpful for you to read. I recommend that. But if you have any other bacteriology tables or what are the tables which specifies the characteristics of the bacteria, would be better for you. And then gram negative bacteria, which is E. coli and Salmonella and Enterica, Vibrio cholerae, Shigella, Neisseria, and Helicobacter. Neisseria and cholera and Shigella are always be the topic of interest, people, because they ask too much of questions from this area. So for example, like Neisseria gonorrhea, the treatment of choice may be, or Neisseria meningitis, the treatment of choice may be, or what type of bacteria is the Neisseria bacteria. It's a gram-negative diplococci, and what type of agar it grows, like a Thayer Martin agar and a chocolate agar. You need to know that. So converting the Thayer Martin agar from the chocolate agar will require the addition of vancomycin. These are the small steps they may expect to see you in the. They may expect to ask you in the like your FMG to test your knowledge. And then the other most important bacteria are Mycobacterium tuberculosis and Borrelia burgdorferi and Treponema pallidum, Chlamydia trachomatis, and Legionella pneumophila. So among that, the syphilis, which is caused by the Treponema pallidum, are pretty important, and Chlamydia trachomatis are pretty very important, and Borrelia burgdorferi are pretty important, which is a Lyme's disease where you see the target lesions, and you may see the Mycobacterium tuberculosis. Tuberculosis is always a choice of question, people, whether it's from the PSM or from microbiology or from medicine. They doesn't care about it. Mycobacterium tuberculosis, definitely you may expect a one question from that. Okay, out of 300, you may get a one question from Mycobacterium tuberculosis. So understanding the tuberculosis is really, really, really important. Okay, so anyway, fine. So the next area of interest is your virology. So speaking about the virology, we are having a general characteristics of the virus, structure, replications, and all those things. And where we need to talk about the important virus like a human herpes virus and hepatitis classification, influenza, and HIV, and HPV and rabies virus are pretty important. The very important questions that you may expect from the PSM, but with the microbiology integration is your case fatality rate for rabies is 100%. So which is really, really important. And then you have the human herpes family, HHV1, HHV2, HHV3, HHV4, HHV5, 6, 7, 8 till 8 till the Kaposi sarcoma virus. It's all important. You have to read it. And then in the case of your HIV and hepatitis is always a choice of question. Like what are the viral markers? How you have to deal with the viral markers? Like what type of antigen and what type of antibodies is seen in the acute infection, chronic infection, and immediate infection, vaccinated people. All those things you have to remember. You should not mess it up, people. There is a wonderful graph which is given there, or else you can able to read the QRS in terms of your microbiology, which is extraordinary. Yeah. Okay. And then you have this mycology fungal infection. So speaking about the fungal infection, you need to know about the cutaneous and the subcutaneous fungal infections, and then you can go for the systemic ones and the opportunistic ones. So the main important fungi are here. You need to remember are your Candida and Aspergillus and Cryptococcus neoformans and Histoplasma capsulatum and Coccidioides immitis. Coccidioides immitis are the important organisms which you have to remember in the case of your fungi mycology. And even in the antifungal disorders are pretty important, because nowadays the post-COVID they may ask a lot of questions from the mucormycosis and aspergillosis. So which one is having a septate hyphae, which one is having a aseptate hyphae, and which one is shown up in the microscope, and which one is the shown up in the KOH mount. All those things are pretty important, and what type of findings you may see in the KOH mount about the each fungi. Nowadays the choice of question, for example, like a 48-year-old man with the diabetes mellitus and presented with the recent history of COVID has now developed a black color lesions in the skin over his face and nose, that technically directs you to the like mucormycosis. So either mucormycosis or aspergillosis are the choice of fungi all the time. So now, especially after the post-COVID, the mucormycosis is always a topic of interest. So I want you to remember all of them, people, all of them. Yeah. Then now speaking about the parasitology. So the parasitology is a kind of a area where you see the like a helminthus and a protozoal infection. On the helminthus, the main one you have to talk about is your Ascariasis, hookworm infection, and schistosomiasis, and cysticercosis, filariasis, onchocerciasis are all kind of like pretty important steps you have to remember. And then in the case of your protozoal infection, malaria, amoebiasis, giardiasis, trichomonasis, and toxoplasmosis and leishmaniasis are the topic of interest that you may expect to see in the parasitology. So speaking about the parasitology, people, there is one question from the parasitology. If you're lucky enough, you may expect to see 2 to 3 questions, but how you are dealing with it. So for example, like a neurocysticercosis, uncooked pork, and the Tinea solium, uncooked pork, and neurocysticercosis, and Ascariasis lumbricoides, largest hookworm on the intestine that you have to remember, and Brugia malai and filariasis, all those things, the important areas of your parasitology that you have to remember. is in terms of your microbiology, parasitology occupies one of the very important position. So you need to remember at least like like a 10 to 12 bucks in the parasitology. The important ones has been listed out here. That is very important. And apart from that, this concludes the area of your microbiology. So speaking about the microbiology, what are the things you need to know is like number one is your bacteriology, and number two is your immunology, and then the parasitology, and then the mycology, and then the virology. So speaking about the bacteriology, you have to remember most of the bugs, but in the case of your virology, you have to remember a very few one. For example, like herpes family, like a HHV family, and a hepatitis family, and then you have this what do we call it, HIV family that you have to remember importantly. And there are some minimal viruses like the rabies virus, Lysa virus, and all those things that you can remember as a part of the one. But the main ones are these three family of viruses. And apart from that mycology, the main ones are you have to remember is your mucormycosis and your like aspergillosis. And the parasitology, especially you have to remember most of the like helminthic infections and a few protozoal infections you have to remember. Yes. So this is all about the microbiology, people. So with this, we pass our session, and thank you for watching the video. We see you with another subject.